Welcome back to the Magnolia Social Club. My name is Katie, and today I have Allie with me. Allie is our injector. She's actually the longest standing injector at Magnolia Med Spa.
Yeah.
Because now we've got a bunch of newbies.
Which is crazy because this is the longest I've had a job in my professional career. Did you know that?
No, I didn't.
Yeah.
How long has it been?
It'll be 2 years in May next month.
Wow.
Yeah.
So Allie is currently serving our Waxhaw location, a lot closer to her house. It's our newer one. She's our veteran, so she's just leading the pack over there. How's it going?
Good. I love Waxhaw location. It is so fun to be in like a fresh new space. You know, like getting to put things away where I want them put away. And
Just like make it your own.
yes, like just to make it my own space. I'm loving it over there.
So tell us a little bit about yourself. Where did you start? Because you were not always an injector. So
Yeah.
where did you start and what made you want to get into this field?
So I went to nursing school thinking the only place I wanted to work was labor and delivery. Straight out of nursing school, that's what I did. I got a job in labor and delivery. My husband was in the military, so we moved around a lot, but I worked at 3 different hospitals in 3 years. And so that's why I said this is my longest standing job. And I loved it, but I was just kind of tired of night shifts and working all the holidays, working all the weekends. And because we moved so many times, I kept starting at the bottom of the list to be moved to day shift. We were living in Missouri, and I was super bored there. There was nothing to do. We lived in the middle of nowhere.
I don't remember you living in Missouri.
Ugh,
So let me also give a little backstory. I have known Allie since a long time.
Yes.
Allie and I went to the same, did you go there for middle school too?
Yeah, I
We went
started
to-
in 5th grade.
We went to the same private school, and I am several years older than you.
Yeah,
How
I
old are you?
graduated in 2017.
Okay, so I'm 4 years older than you. One of those.
When did
I'm
you graduate?
30.
Okay, I'm 27. Yeah.
Okay, so 3.
3 years.
So anyway, Allie and I, we have known each other for a while. We were on the cheer squad together, and her mom was actually our cheerleading coach. So
Yes, she was.
I don't remember. Did I reach out to you, or did you reach out to me? Did I post something?
I think I reached out to you. So while we were living in Missouri and I was really bored and there was nothing to do, like literally you had to drive an hour to get to a Target. Like there was not even a real
You should
grocery
have got
store
some
there.
farm animals.
Oh God, it was awful. I have a story I'll have to tell you sometime. I had a gun. I was held at gunpoint.
What? Why?
Not really held at gunpoint.
I'm
I went for a walk with my dog and a man like pointed a gun at me.
What?
Yes. Like
wait.
had
What time of day was this at?
broad daylight, middle of the day. This was
Where
in
were
Missouri.
you walking? A neighborhood?
Yeah, I was walking like around the block around where I lived, like sketchy part of Missouri, but
I've
that's
never
where
been
he
to
was
Mis- I don't
stationed.
even know what it looks like.
It was awful, middle of nowhere. But I was so bored that I just like kind of on a whim signed up for an aesthetic injector course. And I mean, it wasn't cheap. It was just something I just was like, I just want to kind of see if I like it. So
Let me just take a risk.
Yeah,
here and
literally.
potentially throw away thousands of dollars.
yeah, it's fine. But I did the course. I was really interested. I think I reached out to you and was like, I was coming home for a weekend. I was like, hey, I would love to come shadow if that's an option. So you let me come shadow Alex. But, you know, at this time I was still living in Missouri. And then we moved back here and I was like, hey, moving back.
Hey, it's me.
I would love to come work for you. And you were like, I'm not really quite ready to hire anybody right now. And then I think it was like a year.
Yeah, I feel like it was like a year later.
Yeah, a year later, you messaged me and you were like, hey, I was pregnant. And you were like, what are your plans after the baby? And I was like, oh my gosh, I'm so glad you asked because I do not want to go back to the hospital.
Can you imagine?
No, I say that all the time.
I mean,
Like my life would look so different right now.
I've got plenty of friends that work in the hospital, and I just am like, I think we're so lucky to be able to have the flexibility and
Absolutely,
the schedule and the
yes.
environment that we do. And now I know a lot of them love it and like that's their passion, and
Yeah.
that's great. We need
Yeah.
those people. But like when you're on call so much or, 24 hours and just, you're hustling all day and maybe there's some blood, like different blood that you don't want. And sadness,
Yes,
like it's
absolutely,
sad.
yeah.
It's not always a happy, hospitals are not always happy.
Yeah.
Glad you're here.
Yeah, me too.
So after you did your course in Missouri, you had that under your belt. What other trainings did you go through besides that training? And then I'm sure plenty of shadowing our previous injector. What else did you do? Because we get all the time. I
Yeah.
get DMs all the time. I am working in a hospital. I'm doing this. I'm an
Yes.
NP, blah, blah, blah. I've never done anything aesthetic, but I want to.
Right.
So, like, what advice, I guess, would you give those people? What did you do that helped you?
Yeah.
get here?
So my best advice would be learn facial anatomy. That's something they don't teach you in nursing school. Like you take anatomy, but they're not going to focus on the facial muscles and arteries and such. So I took that time to really study. I didn't actually like attend any more courses. I was super fortunate that Alex kind of taught me like
yeah,
all the like hands-on, because you can go to the one of those courses, but they don't.
you don't get a
teach
lot of
you-
one-on-one.
You
either.
don't. So we had like a online lecture, and then we had an in-person hands-on day. It was one day, and people could pay like a really discounted price to come and be a model. And we had one person who wanted filler. So like, and there was like 6 people in the class. So we
Yeah.
all got to do like one pass of lip filler, and that was it. So it really was not enough for me to be like, okay, I'm ready to be a nurse injector. So yeah, I just took that time to really like study, learn. That's the one thing about the aesthetics industry is like you will constantly be learning. You know, there's always something new coming out. But the base of being a good injector is getting comfortable with your facial anatomy.
Yeah. I think it's important for injectors, or at least the ones that I hire, to take one of those courses,
Yes.
like you did in Missouri.
Yes, it definitely gives you like a basis.
You
of,
get a good
yeah,
outline, and then when you come in here, at least to our practice, we can kind of like fine tune it and, you know, turn it into
Yeah.
what we want it to be, but you have some basic knowledge.
Yes, I'm glad I did the course, and you definitely should do one. But there's nothing
Yeah.
quite like the hands-on training.
Yeah. So if you are interested in injecting and you haven't done that before, then we would definitely suggest being proactive and going out on your own to get that certification and learn from, you know, like a big group setting.
Yeah.
And then dig into asking med spas if you can shadow and whatnot.
Yeah, yeah. And then there's like some books on Amazon. If
Isn't
anybody
there like a $100 coloring book or something?
I did buy a $100 coloring book. I'm like a visual learner, someone who needs like to write things down.
Yeah.
I have to hear it. I have to do it. I have to see it. I have to write
Have
it.
to color.
I got to color it. And so I bought this like anatomy coloring book, and
You put that on
Chrislyn,
too, right?
Chrislyn borrowed mine, so
Oh,
she just
okay.
has mine. Yeah. But I do think it was helpful. But yeah, I bought some other like books that I've found on Amazon that talk about, you know, just general dosing and things like that were
Yeah.
helpful. So if anybody's interested and you're like, hey, what are those books? Message me and I'll give you the link to those.
That's so kind of you.
Yeah.
Okay. How would you describe your aesthetic style?
Definitely very natural. I would say like a conservative injector. And I think that's what people want now.
Yeah.
And, you know, people appreciate that.
And we don't have an issue. I always back all of my staff up, but we don't have an issue saying no.
yeah, for sure.
You have to.
There is such thing as like filler blindness, and people will come in and think they need more. And it's like, no, you don't need more.
Yeah.
That's going to actually, it can make you look older if
Yeah.
you like
Yeah.
are overdone.
Yeah.
So yeah, definitely very natural.
What would you say is something that makes you a great injector?
I try to really take the time to get to know my clients. Like I like to know them on a personal level,
Yeah.
not just
In
like,
and out.
Yeah, not just in and out. I genuinely care.
Mm-hmm.
Katie can vouch for this. I go home and I stress about my clients. I have anxiety about you. Like I want them to be happy.
Yeah.
And I like sometimes I have, especially when I first started, I would stress for the entire 2 weeks until I heard back once their Botox kicked in,
Yeah.
if it was good or not.
Yeah.
And yeah, I care. I do. And I want my clients to be happy. And I don't want to just take your money. I'm going to tell you what I think you truly need. And I want to do it well.
Yeah. I love that. I love that. because you're definitely getting to know them more on a personal level, and you taking the time to do that shows that, like this is not about just your commission or like,
Yeah,
a transaction. It's you're passionate about it.
definitely. Yeah.
Let's talk about some different treatments. What do you offer as an aesthetic injector at Magnolia?
Yeah. So I offer Botox, Botox and Dysport.
And what is the difference between the two?
So I like to tell people they're like Pepsi and Coke. Yeah.
Smart.
So Botox, they're both botulinum toxin type A. They're very similar, but they also have some key differences. So Dysport's going to kick in a little bit quicker. It starts to kick in about 2 to 5 days. Botox starts to kick in at about 5 to 7 days. But they both take 2 weeks to fully settle. So it's not something, if you have an event, you come in on a Friday and you have an event on Saturday, you're not going to see a difference. And they're both FDA approved for 3 to 4 months. We do a lot of Dysport in our
We
spa.
are such a Dysport
People love
office.
Dysport.
I am Dysport.
I am too. I
feel like
love that
all
it
the
kicks
staff are
in.
Dysport.
Yeah. We like how it kicks in quicker.
Yeah.
And I feel like for a lot of people it might last them a little bit longer.
Yeah.
So
I agree. And I feel like too, it's smart if people have never done them both to try both of them, because
Absolutely,
you may like
yes.
one over the other.
Yeah.
And I have tried Botox one time and it just was not for me.
Yeah.
But some people are like Botox, 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 and they love it.
Yeah. I have some clients who they don't like Dysport at all.
Yeah.
And that's fine. And that's why I do think it's important to try both.
Yeah.
They're both great products.
So we have Botox, Dysport.
Fillers. We also have Sculptra, which is about biostimulator, Skin Vive, which is like a skin booster, Hybella, which is a fat dissolver for like under here.
Yeah.
I could probably use some of that.
Yeah, right.
I'm trying to think. I think that's most of what I offer.
Yeah, and we're getting into peptides.
Yes.
And we have played with PDGF,
Mm-hmm.
pausing that because of some.
Yeah.
We've played with it, and we always play with things on each other before
Yes.
we launch it to the public.
Yeah.
But PDGF, I think there has been some like interesting things
Yeah.
that need to.
There's just
they need to
not
work around
studies
first.
on it. Yeah. And just, FDA approval, which that takes forever.
Yeah.
So.
What would you say is your most popular treatment that you offer? And then what's your favorite?
I think my most popular is Dysport. And then
Because also
behind
people
that,
can be like in and out in like 15 minutes if you needed
Yes.
to be that quick.
yes. And then behind that would probably be lip filler. I think lip filler is my favorite. I was so scared of lip filler when I started. I'm pretty sure after I did lip filler for the first time, I told Alex that I never wanted to inject lip filler ever
Are
again.
you serious?
Yes, I hated it. I mean, it's just
Why?
it's so different than anything else you do as a nurse, because you do retrograde injections. That means you're pushing the product in as you're pulling the needle out. So, and it's just like very different. It feels different. It just, I don't know. It scared me. And
Who did you do it on for the first time?
my mom,
Oh,
yeah. And I literally don't even think that I don't think I put anything in there.
you were because
Yeah, I was too scared.
you're like, Alex, I'm never doing this again, and she's like, you didn't do it at all.
Yeah, literally. But now I've grown to really like it, and I
Yeah.
appreciate like the art of lip filler, and I've enjoyed trying new techniques, and
Yeah,
I really like it now.
yeah. I think you do a good job.
Thank you. I always
Um,
feel like I made it if Katie comments on one of my posts.
Yeah. Thanks.
She comments on my post. I'm like, okay, that's good work.
Repost, reshare, all the things. When should someone start injectable treatments?
Yeah, so I do believe in preventative Botox, because if you're never allowing those muscles to create those wrinkles, it's a lot easier to prevent than to fix.
Yeah.
So I think like, in your mid to late 20s, if you want to start getting Botox, then great. You might not need to get it like as often.
Or as much for sure.
Yeah. You don't have to go crazy with your dosing. And then with filler, I'd say, like, I feel like I have a lot of clients who come in who are like in their 20s and all they really want is lip filler. And I think that's fine.
Yeah.
But once you're, in your 30s, 40s, then a lot of times we need to consider putting filler in other places too, not just your lips. Because if we just do your lips, it's going to be noticeable.
Yeah. It's not gonna look natural.
Yeah. And if you want natural results, then we need to,
Treat the whole face.
treat the whole face. And then with biostimulators, I really recommend, starting Sculptra when you're in your 30s. Oh, I know.
That's one thing I haven't done is Sculpture
We'll
yet.
have to do that soon.
Yeah, where are you going to put it?
So it's just going to help keep your skin looking nice and tight and youthful. So
Okay.
collagen loss starts in our 20s. We lose 1% per year. And Sculpture helps us just stay on top of that. So just stay on top of that collagen loss. I'd say, you could just do 1 or 2 vials and you'd be fine. And then just do 1 per year.
Okay. Oh, God, add it to the list. I feel like I hold on to lip filler really well, but I feel like I would maybe like a little bit more in my cheeks.
Yeah. And Sculpture can help with that.
Okay. Sign me up, cuz. Let's talk about something maybe not as exciting, but important. Safety and misconceptions of injectable treatments.
Yeah.
Why is it important to do research about choosing your injector? Why is it important to not go on Groupon and just pick, I'm sure there's people on Groupon.
Yeah.
I don't know. We're not. But why is that important to do your research?
Yeah. So there's so many people who want to get into the aesthetic field. And I get it. It's fun and exciting.
So many people want to do it.
Yes. And so it's important that you're going to an injector who has proper training, who is using real products. If it is a really good price, then it's probably too good to be true. And you should be questioning if you are actually receiving the product you're being told that you're receiving.
Yes, this is a hot topic, and it kind of makes my blood boil a little bit because I know of somewhere. I'm going to make it very broad.
Yeah.
I know of someone in the Carolinas who advertises a certain product, and we know that it is not that product because our reps have confirmed that it is not that product. So yes,
and also the
major
prices,
red flag.
Yeah, like the prices.
Major red flag.
There's
no way.
She's not making any money.
There's no way. Yeah,
I'm sorry.
She.
Yeah, she.
In the Carolinas.
Yes.
Yeah, if you are just shopping around for the best deal, you can expect the worst result.
Yeah, and
also, like, what even is it?
Yes, and you guys, please, for the love of God, do not buy Botox or filler from TikTok Shop or whatever.
Oh, is that a thing?
People are doing like live videos on TikTok now of like live DIY injections.
Okay, so let's talk about we're talking about safety. Why should you not do your own lip filler at home? What are we really looking out for, and that can be super dangerous?
Yes. So the biggest risk with fillers is what's called vascular occlusion, and that's where filler could accidentally be placed in a blood vessel and block blood flow. That can cause things like necrosis. It can cause stroke. It can cause blindness.
If someone doesn't know what necrosis is, tell them what that is.
It is tissue death. So it can make the tissue on your face die.
And literally like become black and like
slough off.
No good.
Yeah, so I have a whole new fear unlocked when I saw that people are doing this on TikTok, because I don't want someone to come to me with an issue and ask me to fix it when I have no idea what you just injected into your face.
It is a huge risk, and likely your injector may not be able to help you. Like they're probably going to be like, go to the ER.
We have a drug called Hylenex that we use if we ever had an emergency situation, but it dissolves hyaluronic acid fillers. There are other fillers on the market that aren't hyaluronic acid fillers. So those cannot be dissolved with Hylenex.
So if someone's blindly putting something into their lips, not knowing what it is, there's a chance we might not even be able to get rid of it, and then they can risk necrosis and their face falling off.
It's so dangerous, so please do not do that.
Yeah, if you take away anything from this message, get off of TikTok Shop.
Yeah.
And get off of Groupon and all that. Everyone wants filler. It's super hot right now. Yes, it is expensive, but number one, you're paying for a product that has been studied for years and years and years. You're paying for an injector who has studied for years and years and years, their expertise, safety, sanitation, things are clean. We're not risking infection because we, maintain cleanliness and sterilization. So you are paying for good and long-term and safe results.
Absolutely, yes. Do not do that at home.
Okay, we hit on a risk of a bad injection with filler, but what would a risk of bad injections with neurotoxin look like?
Neurotoxin, it's all about the placement of where you're putting it. So if you are trying to do that yourself, or you're maybe going to an injector who doesn't have.
I have seen the at-home, I'm backing up. I've seen the at-home lip filler, like gun things.
Oh, those hyaluronic acid pens.
I don't know,
whatever.
but like, is there actually a TikTok shop of Tox?
I don't know if it's actually on like TikTok shop, but there's people on doing TikTok lives with DIY injectables. I don't
they
know
bought
where
it
they get
online.
them from. Yes.
Oh, okay.
Yes. I don't know. They're buying fake Botox from somewhere.
Yeah. Like, because Allergan, who owns Botox, and Galderma, who owns Restylane Dysport products,
Yeah.
they will not sell online. You have to have a medical license to even get that ball rolling. So it is not going to be
It
the
is
real
a
deal.
highly regulated. I mean, it is a drug. Like it's a
It is
highly
a drug,
regulated
yeah.
drug,
Yeah.
and so it's not something that you can just go online and buy. So if you're doing that, it's who knows what you're getting.
Yeah. So the placement.
The placement, yeah. So it's all about the placement. So if you're going to an inexperienced injector or you're doing it yourself at home, you risk, I mean, just really messing up your face. Who
Ptosis.
knows? Yes. You could cause droopy eyebrows. You could cause droopy eyelid. You could make your face look
Yeah.
like you got, I don't know, something going on.
So the issue with Tox, if it's injected incorrectly, you can't do anything about it.
No.
It's
yeah.
just time. You have
Yeah.
to wait. Luckily with filler, like we were talking about, if there's an emergency situation, or if maybe somebody came in from another office and they,
Right.
their lip filler was placed incorrectly and now we have migration and whatnot, we can Hylenex that.
Yes.
But with, wrongly placed Tox, you just have to live with that
Yeah.
for 3 to 4
You
months.
just got to let it wear off.
Yeah.
Yeah.
And that's tragic.
Yeah. Nobody wants that.
How can patients that are maybe listening to this avoid the overdone look? How can they maintain a natural aesthetic?
Yeah. So when you come in to see me, I need you to trust my professional opinion.
Yes.
So if I am telling you, and don't come in telling me how much filler you need, what your dosing is going to be with Tox.
Retweet.
You need to come in and let the professional decide that. You don't go to your doctor and say, this is how many milligrams of my heart medication I need.
Yeah.
This is the same kind of thing. This is a prescription drug. So you need to come in and let us tell you what you need.
Yeah.
And so I think when you do that, then you're going to get better results. I also think it's important to look at your injector. If your injector is overdone, that's kind of their style. That might be what they're into.
Yes,
so
yes.
if your injector looks crazy and you don't want to look crazy, then that's a red flag. You might want to find a new injector.
That's facts.
Yeah.
And
I think that's what's great about our office is I think that everybody who works here, we have a very, natural aesthetic.
Yeah. I mean, we all look great. No,
Oh,
but
shucks.
no, 100%, because you will see offices that maybe look like it's just like a little too much.
Yeah, yeah.
And
There's a lot of that out there.
I would love that, if I started to go down that path, if somebody pulled me aside and be like, yo, like, let me take a picture of you real quick and show you. We're doing too much. Yeah. I don't think I'm not attracted to that.
Yeah. I also think that clients now appreciate when you're honest with them.
Mm-hmm.
If you tell them, hey, I really don't think more lip filler is the answer.
Yeah.
They respect that.
They
and
do.
they want to come back.
Right. Because you are also considering their wallet.
Yeah.
You're not just like, yeah, sure.
Give me your money.
Yeah, exactly. What's a common misconception about Botox and then also filler?
Everyone comes in and they, like first time clients, especially with filler, they are scared to death of looking crazy.
Mm-hmm.
And I mean, I don't blame them because you see Hollywood and people look crazy.
Yeah.
But we have moved away from that so much, especially in the last few years from the overdone look. So I think one of the biggest misconceptions is that filler, like you always look done when you have filler.
Yeah.
But the truth is that filler that is done well and placed correctly looks so natural.
Yeah.
And it should be undetectable.
Yeah.
It shouldn't be like, oh my gosh, you got cheek filler.
Right.
It should be like, wow, you look really good. Like, I don't know what
are
you
you
did.
doing?
Yeah. But like something looks better. Like something looks refreshed about you. And that's definitely my approach with fillers is the refresh look. And then with Botox, I think just people think that they're going to look like this when they get Botox, but I mean, I have dysport in my forehead. I can still move my eyebrows.
Same.
You know, it's like you can still look very natural and people don't have to know. I have so many clients who their husbands don't know they do this, and it's because their results are still so natural that their husbands don't even notice.
Yeah, exactly.
I mean, is it that or is it that men don't pay attention? I don't know, but you
maybe,
know what I mean?
maybe a little bit of both.
But yeah, so you can get injectables and still look natural.
Yeah. And I think we've said this on here maybe with Alex, but 1 syringe of filler is enough to fill 1 blueberry.
Yes.
We're not talking about 1 apple, 1 orange, 1 tiny little blueberry.
Right.
So yeah, don't be scared of a
And
little
that's
bit of
why
filler.
when people come in and they tell me they want half a syringe split between both their cheeks, I'm like, that's literally going to do nothing. Like you're not
wasting your money.
Yeah, you're wasting your money.
Yeah.
You're not going to be able to tell a difference.
You're not going to be happy.
You're not going to be happy, and you're never going to want to do it again because you'll be like, it did nothing. But that's because you got nothing in your face.
Yeah, literally. That's why you need to listen to me.
Yes. Just trust me.
What mistakes do clients make before coming in?
Things that you definitely, a lot of people don't avoid the things they should avoid. So alcohol, NSAIDs, aspirin, fish oil supplements, things like those.
Pregnancy.
Oh yeah, that's a big one. Pregnancy, breastfeeding, both of those, no-goes. You need to avoid anything that's a blood thinner. And if you don't and you bruise, don't be mad at me. Like people come in all the time and they say, don't bruise me. But that is a bad, it's not fair for you to put that on me because do you know how vascular our face is?
Right. Everyone's different.
Yeah.
And sometimes you might bruise and the next time maybe you won't. We talked about a little bit about some red flags that maybe patients should look for in injectors.
Right.
I guess based upon what they want their outcome to be. But what are some red flags that injectors look for in patients?
Yes. Okay. I would say the first one is when a client comes in and has a history of going to 10 different med spas.
Yeah.
I don't think you should injector hop. You need to stick with somebody. And if you keep going to all different places because you're not happy with the results, then maybe you have unrealistic expectations of what can be done with injectables.
You're starting from the bottom every single time when you move around.
Yes. And this is not surgery.
Yeah.
This is not a facelift. There's great things we can do, but I'd say that's one. Another one would be when you come in and you tell me what your dosing needs to be and how much filler you need. That's also a red flag to me because you need to trust me as the provider.
Yeah.
And then another one would be when you come in with a $100 budget and you want your whole face done. That's
a red flag. That's when we will send you to the Groupon place.
Yes, I'm like, I don't think I have anything for you.
Would you like a cup of water?
Yeah, literally. So those are some of my red flags.
Have you had someone come in before with like a super small budget and then they've not gotten treatment done? Or do they typically like understand and are able to move forward?
Yeah. So I explain to them that if you are very limited on your budget, then you need to pick one area to focus on. We cannot if you want to come in and you want to do just your crow's feet, that's fine. We can do that.
Still going to be more than $100.
Yeah, it's going to be more than $100. But if you want to do that, that's fine. However, when that kicks in 2 weeks and you're nice and smooth right here and not everywhere else, it's going to look kind of weird.
Yeah.
And so I do think you need to, if you only have $100 in your budget, then this might not be what you should be spending your money on.
That's true. It is. It's not cheap, but again.
But that's why we have things like Patient-Fi.
Yeah, we do have things like Patient-Fi, Patient-Fi ad. Go ahead with your Patient-Fi ad.
Yeah, so Patient-Fi is an interest-free way to finance your treatments. Your first payment is not due until a month after you're treated. It is,
and it can be as little of a payment or as large as the payment. Too.
Yeah. And it's just a great way to, if you really want to invest in a nicer treatment, you want to do facial balancing, then maybe you do Patient-Fi because it's there.
Nice it's available. Yeah. We have plenty of patients that use Patient-Fi.
It's not going to affect your credit score or anything like that.
Yeah. And we've loved working with them. I feel like it's been just super easy and everyone loves it.
Yeah.
Yeah. It's always nice to have that option. If I don't have to get rid of $500,000 in 1 second, then
Hold on, what are you buying?
a lot. I've done a lot of shopping lately.
Oh, Katie.
I know. I got some trips planned.
No, I have too. I've been shopping way too much.
I need to stop.
I told my husband, I was like, you need to take the credit card away from me.
Yeah, well, my husband tries to take the credit card, but
You find another one.
well, it's just like on my phone. I don't even have to use it. Just
She's
like,
memorized the
look,
numbers.
here it comes. Here it is.
Apple Pay.
Yeah.
I know. Apple
All the
Pay is
time. It
dangerous.
gets you. And then now you can go online and just like
Oh, I know.
hit Apple Pay.
Yeah.
Crazy. Okay, so let's do some rapid fire questions.
Ooh, fun.
Okay.
Okay.
The first one is, what treatment is everyone sleeping on?
I think full face Tox. So if you are treating your upper face, it is time to start treating the lower face with Tox. And when you do that, people love the results.
Yeah, I would also say, for me, something that I get done now and didn't usually before is masseter Tox.
Yeah.
And so your masseter is this muscle right here, like your jaw.
Yeah.
That muscle right there, when you clench, you can feel it. Usually people, or historically, people would get masseter Tox to help with TMJ.
Right.
And clenching and migraines and this whole thing. I don't have TMJ. I started getting that Tox right there because it helps to slim your jawline,
Right.
making your face more like
Heart shaped.
snatched.
Yeah,
And
yeah.
not like round. If you look at pictures, I mean, you know me when I
yes.
was like,
It is
lot younger.
crazy how much Master
it
Tox changes your face.
changes your
Yeah.
face so
It does.
much.
And the other thing, because not everybody's a great candidate for Master Tox. For some people who have like a lot of skin laxicity, it can actually cause
More.
jowling. But for those people, they need to get platysmal band Botox. So
and where it showed them
the
showed
Nefertiti neck lift is what a lot of people know it as, and that's going to be injecting along the jawline and then into these platysmal bands in our neck, which I have really prominent ones.
I was gonna say, I see them, baby.
When you inject that, it snatches the jawline too,
yeah.
and it really
way it
helps
has
with
changed my
any.
face is
Yeah,
insane.
it helps with downward pull on the face.
Yeah. So I don't have TMJ or any of those things, but I feel like I can tell when it starts to wear off because it just feels maybe
Different.
heavier or
Yeah.
something. And then the Tox makes it just feel lighter. I
That
don't know.
makes sense.
What is one area people ignore but they should treat?
Again, the lower face.
Yeah, the lower face. Yeah.
And also people who come in wanting lip filler, but they need balance other places. Because if we keep filling your lips, then the chin starts to look a little more, I don't know, like you need a little more
Chins
length.
are super important.
Chins are so important. So the power of a lip and chin combo with some filler
Yeah.
is incredible.
Yeah, I got chin filler probably a couple of years ago. It may be time for more, is it? Maybe.
No, I think your chin looks
I'm
good.
doing okay.
Yeah.
But like, I'm sure people have seen those videos on social media where like they'll take celebrities and chop their chin off,
Yes.
not like actually, but like on a picture.
They have like a recessed chin.
Yes.
Yeah.
And then they add the chin and it's like the chins are so important. Otherwise you look
Odd.
different. Yeah.
Different.
So probably chin filler is another one people are sleeping on.
Oh, I think so. Yeah.
Yeah. What is the most overdone treatment that you see?
Most overdone. I'd say lips.
Yeah.
People come
100%.
in with,
You can tell sometimes too.
yeah. I am all,
Yeah.
people ask me all the time, like, well, what do you do with your lips? I got my lips filled. It's been almost 2 years.
Yeah.
And
Some people just hold on to
because-
it well.
Yeah, I think I hold on to it well. I get lip flips to kind of like give
haven't
me
had a lip flip.
Oh, what? Ever?
No.
I love a lip flip. I don't know if you need it though.
Okay,
Because
good.
when you smile, like your lip still shows really
Yeah,
pretty.
okay, amazing.
Mine rolls under a lot. And just because I tell you that your lip filler is going to last you about 6 months to a year, that doesn't mean like at a year, poof, it's gone.
Yeah.
And so,
It's FDA approved for that amount of time.
right.
Yeah.
I feel like mine's lasted me a lot longer. And I don't think you need to like plan to come every year. But when you come in for your Tox appointments, let's look and be like, hey, do we think we need more?
Yeah.
But just because it's, FDA approved for that time, you might get more out of it.
Or you might get way less. Like there's
might get way
I
less.
know personally a couple of people who like
Alex?
just well, Alex, yes.
Yes.
But then some others too who like literally are filled for maybe 4 to 6 weeks and they just don't.
Yeah,
their
somehow
body
some
just
people
don't.
just like metabolize it really fast.
Is it true that taking a zinc supplement could help prolong the effects of injectables?
So
Is it just neurotoxin, or is that just like honestly not even true?
that's with neurotoxin. I've seen mixed things on that. I think it just maybe depends on the person.
Yeah.
Honestly, I don't think there's like scientific evidence that yes, it for sure does. But I do think for some people, a zinc supplement can help prolong the effects.
What's one aftercare tip everyone should follow? Okay, there's probably several. So let's do what's one aftercare tip for neurotoxin and one aftercare tip for filler.
Okay, so one aftercare tip with neurotoxin, I definitely would avoid working out for 24 hours. And the reason for that is if you are working out and sweating heavily in that first 24 hours, it can make it not last as long. And so don't be sad if you work out in the first 24 hours and then you feel like you're going through it quick. And then with filler, the biggest aftercare tip would be to keep your face really good and clean because you don't want infection. So no makeup.
Yeah. What can happen if someone, I'm literally thinking of Alex again because this happened to her mom, lip filler, and then immediately after grabbed like just an old lip gloss that she'd been using for a while and then put that on, and then
we're creating so many needle pokes when we do filler that when bacteria gets in there, you can get a really nasty skin infection. And so that's why we tell you no makeup, keep your skin really good and clean for that first 24 hours. After 24 hours, go ahead, put your lipstick on, that's fine.
Yeah.
But you do need to keep them clean.
So we talked about a red flag in a client. What's a green flag?
I love when a client comes in and sits down in my chair and they're just willing to, let me make them a treatment plan. And they trust me. I know I keep saying trust, but when you come in and you trust me, like that is going to make both of our lives easier because then we can get through those treatments and you're going to be the happiest with the results.
Yeah, I second that because when I'm doing a consult and they're like, oh, just tell me what I need. I'm like, okay, perfect. Because like, I don't know you from anyone. And so when I see you, I'm going to be drawn to that one thing that I notice most, right? Like, I'm not an injector, but if somebody comes in and they are overfilled with, their lips are just insane, then my first thing would be like, okay, first we're going to erase this. We're going to dissolve this and then we can restart.
Yeah.
But yeah, I love when somebody comes in and they're just like a blank slate and they're open to what you have, like what you can offer them, and then they let you lead.
Yes. And then I also appreciate someone who does the work at home. Because like we've said, I can do these injectables to your face, but if you're not using good skincare, you're baking in the sun, going to the tanning bed, you are not doing any of the other treatments that we offer. Because I really do think your best results are going to be injectables, but also taking good care of your skin. So if that means facials, microneedling, lasers.
Yeah, exactly.
It all goes together.
Yeah, you can't take care of the wrinkle and then your face still look like a beaten leather bag. Like you're just still going to look like it's just going to be without wrinkles.
Yeah. No, literally.
You're going to be a smooth piece of shit.
And if you don't...
Sorry.
If you don't wear sunscreen...
She's canceled now.
Oh my gosh. If you don't wear sunscreen, then just don't even sit in my chair.
Yeah. I mean... That's the hard truth.
Yeah.
And maybe the way I say it sometimes is a little off, but I wouldn't say that to someone's face, just to their ears that are listening. But like, it's
need to
true.
hear it.
We know what we're doing, and yeah, it's definitely like an all-inclusive. Aesthetics in general is an all-inclusive environment. It's an all-inclusive treatment.
And protect your investment. So if you're going to do all the treatments, put in the work at home.
Right, exactly. Well, thanks so much for being on the Magnolia Social Club. I feel like we got to answer a lot of...
I'm only a little sweaty.
Burning questions. You could do talks in your armpits for that.
Oh, I know. I need to. I really do want to try that.
Yeah, go ahead, girl. Well, thank you, and we'll see you guys next time.
Bye.
Thanks for listening to the Magnolia Social Club. You can follow us on Instagram at Magnolia Med Spa and on TikTok at Med Spa Magnolia. Bye.
Bye.